So I think there's an interesting mixture here of from the ground as well as a broad global view. And we'll take questions. One question I'll just start with, which is really to the room, is in hearing what Bruce presented from Haiti, which seemed quite compelling. Is that a case study that's peculiar to Haiti, or those of you who are working in countries around the world, do you see that as something that is realistic in the countries in which you work? Yes, Bill.
There are national efforts to implement EMRs ongoing at various stages now in Kenya, Tanzania, Rwanda, Mozambique, Bangladesh, and the Philippines. And they're all implementing the same system, but there are other activities that are going as well, and they're all at different stages. They can learn a lot from each other because they're all doing it a little bit differently. They're going to be using them a little bit differently, but there are some standardized approaches to what they're doing, and there actually is a consortium of them, so it's probably worth making that part of all this.
And just to follow up on that, and I'll be right with you, Mike. So if countries are working on that, are there people who are in the quality field that are actively working with those countries to interject some of the quality indicators and variables into the HMIS?
Yes and no. I mean, they're all being used for that, but the connections are all haphazard. And so I think there's a lot of opportunity for improvement there, at least to my knowledge. In that I'm the chairman of the board of directors of OpenMRS Inc., and that's the platform that's being used for this. So I'm filtering. I got filtered stuff brought to me, so I know a little bit about it, but that level of detail I don't know. But I know a lot's happening that suggests that that it started, but a lot could be made better.
And there's an opportunity there, I think, is your point. Yeah. Okay, Mike.
Yeah, it's really in response to your question, and it echoes a question I was going to ask. So So in the Kenyan sector, which I'm familiar with, the EMR setting is really quite anarchic. So there, and the HIV world is a different world. So there has been a 10-year development of EMRs for HIV-specific services, and they are now a completely parallel beast, with no communication whatsoever with the National Health Information System. I'm not saying that's a bad thing, that's just what is. I personally believe that, however, that part of the world, and I guess others, it is what we need. And it will happen because these countries are wanting to make that leap, but they could make some rather disastrous leaps, and they could learn a lot from what other countries have learned of their mistakes on the way. So I think strategically, as a long-term aim, it is definitely one of the better bets. I would just caution, well, maybe Bruce, you want to comment. I think one of the difficulties for governments I've seen is that they see figures like what you put on the screen. This system costs $400,000, and they think, oh, great, $400,000, and I'll be sorted. And clearly it is nothing like that. I mean, that may be what it costs to pay somebody to develop a specific bit of software, but what you've described is a whole new cadre of health personnel, and the analytics to go with it. And that's a big long-term strategic investment. And countries do need to start now, but they're not going to, they're going to need to have stages along the way and clear priorities, and I think that really does take some thinking about, but it's definitely the way to go. And I think the big issues with interoperability, which Western countries are grappling with, they could be tackled now if people get their act together, but we're going to miss the boat. Even in Kenya, which is relatively low income, we're just doing a survey of, and we've come across a number of small local software providers selling EMR systems to public hospitals, and absolutely nobody is giving any thought to health data. It's all about billing. But there is an opportunity there to really influence things for the long term, but it is a long-term agenda. If I can ask my question, it was really to Nick. You gave us a long list of things which kind of need to be aligned. If you're starting from a blank slate with not much going on, what would you target as the most important thing to try and get right first?
I tend to think there is not such a thing as a blank sheet. That's not there, but in terms of development, you always assess where is this system at this moment, and yeah, the focus is very much on the information infrastructure. So it would be what kind of data are there, what kind of logic is there. Like you said, in some countries, when there have been horizontal programs, you see that those niches are perhaps good developed, but is there a kind of national approach, system approach? In that debate, again, I don't know about the evidence of system development, which you should do first. I think it's more opportunistic, seeing what is there and where is a pocket where I can build one of these components. One of the remarks, I will do what I see with electronic health records, and that's not an OECD bet, but what worries me is that I see that most of these activities are hospital focused. So I see very much a development of the hospital industry, especially in the middle income countries. That's also where the system development of electronic records is. So at this moment, one of the big hindrances for health system performance in the industrialized world is that we have very poor information systems on primary care. So it takes a lot of doing it. So in terms of taking the opportunity of when you are in that phase of your system development, it would be very good if these kind of projects, but also on the policy level, would help. If you do an electronic health record, then at least make it a health record that already crosses the boundaries between the different systems, and it's not just a nice part of the hospital system, which is getting bigger and bigger, so that in 10, 15 years' time, you still can't figure out very simple things like readmission rates and how the treatment of a patient with a chronic condition in primary care is linked to the admission rate in the hospital.
Just for clarification, Jim, or anyone who knows the answer to this, what proportion of overall investment in quality programs would you say actually goes towards information systems of any type?
Very small.
Well, you put me on the spot. I think that it's probably about, I don't know, 15 or 20%. It's a large minority of investment.
So not insignificant.
Not insignificant.
Okay. Questions? Yes, and if you could just say who you are when you ask your question, please.
Sure. Troy Jacobs, USAID. Bruce, your example was with Haiti, and this sort of feeds on what Mike was bringing up, is that there's a potential platform with a number of countries and donors supporting DHIS2, which has been rolled out in a number of countries that you do work in, that's in various stages of implementation. And this certainly seems like a platform to at least look at. One of the, and so maybe you can comment on that. The second issue was a question that I had. It relates to the issue of sustainability, and that we often think about sustainability in terms of technical issues, but I think we need to think about the financial aspects of sustainability, because there is momentum that is built for systems, and it may not be that these are the best systems, but these are the systems that in fact get rolled out. And so I think that we have to think about these issues and the issues of finance as it affects sustainability, because in fact, we may not have the best system or the right system, but we have the system that got momentum behind it, and that's the system that then we're working with. That's not to say that DHIS2 is the way to go, but I certainly think that there is a platform and there's momentum there.
Yeah, so thank you. So a number of the countries that we work in are rolling out DHIS2, and I think it's analogous to the MESI system in Haiti for monitoring and evaluation. We've been asked by at least one ministry to help them map out how to include their quality measures into DHIS2. And I think that's really the way to go. I think the goal is to minimize the burden of the data collection whenever possible. So I agree with you, and I think, when I understand, it's a pretty user-friendly system. And just in terms of sustainability, I realize that there's a lot of skepticism about the dollar figure. I think Haiti's pretty unique in that regard also. The cost of labor is embarrassingly cheap there, and there are a large number of people there who actually have the skills to do the IT work, which I think has not been the same in a lot of other countries that I've worked in, for whatever reason, in terms of training or other experience. So it is a factor. It's probably not counting the additional costs that were attributable to the people doing other things that also help support the rollout of the system. But I would say that even if you added on to that, it's still remarkably cheap compared to what we would have to pay elsewhere.
Time for two more questions. Yes, please.
Thank you. I'm Kathleen Hill. Thank you very much for those really interesting presentations. And I very much agree with what I think people have been saying, that this really is the way of the future in terms of EMRs and all. I would like to, though, just bring us back to the reality of many of these clinics, which is you have stock out of basic paper. You've got notebooks that are bought from the schools where children go to school, where people are drawing in lines, trying to put in basic data. So I think it's really important that we remember sort of where we're really starting from, even as we're being really aspirational. And we know that 50% of newborns in the world have a birth weight documented. So, you know, before we even talk about more complex quality, I think we have to be very humble about where we're starting, much less when we talk about NCDs. But the other point that I'd like to just ask your opinion about is, I think that in terms of EMRs and having primary data, which has been such a key theme from today, very rightfully so, we know that having data at the point of care is essential for improving quality just in of itself, to know what your patient's blood pressure was yesterday, et cetera, and as a point of care decision-making tool and integrating clinical decision support into EMRs. But I think the thing I'd like to maybe push a little bit is around the very measures that we're tracking related to quality, and I didn't hear so much about that. And I think from my perspective, at least, in terms of working on quality, that's where we really still have a lot of work to do. And I know that many of us in this room were at a meeting in Geneva in December where WHO was looking at quality of care measures in maternal newborn child health. I mean, we're still really grappling with some basics there. And I'd like to maybe push us a little bit in this conversation to sort of really try and go into that area in a little bit more depth, because I think that's, in terms of low resource settings, where huge amounts of need still exists.
Point well noted, and that's one reason why we have Nick here, to raise the issue, even though it's very ambitious, as to whether there could be some standardization of quality indicators, a core set for low and middle income countries to work in that direction. Okay, one last question, please.
Thank you very much. My name is Donna Jacobs from URC. Bruce and Nick, thank you very much for the presentations. My question is just really, how would you use the gains you have achieved on the ARV program or using quality indicators to strengthen health systems across the board? So not just the HIV program, which is currently funded, but how would you use these gains across the board, especially in countries where DHIS is being rolled out, or we are still using the paper-based recording system, you know, the register-based system, the types of clinics that Kathleen is talking about?
So I've been asked to be short, but I really want to I really want to thank you for raising that issue, because I think we have an opportunity now that's unique because of the platform of PEPFAR funding to fund the systems. And I think if we're serious about health system strengthening, then it should be part of the planning to actually leverage the HIV systems to do what Haiti hopes to do, if it can, which is to go both broad and deep at the same time. And I think being able to do that, you know, there's a real promise ahead of us to focus on. And hopefully there'll be some political leadership to reinforce that through the PEPFAR program.
Well, very shortly, I think the shift from cost control toward governance models that try to steer on outcomes will be with us in the foreseeable future. because it's really implemented. I think the challenge is, and that was in my points, that if you do different things, try to bring the system perspective in it and try to link it to the agenda to strengthen the information infrastructure. And I'm very much in favor of the kind of project you did in Haiti, and I know great examples, but also, and that's why I stress the other things, start with making sure in a country that you have the basic death registry in place, that you have some start with cancer registries that's now expanding. If you see South America now, past 5 years, more and more coverage of cancer care. And the signal I wanted to give now, we're pushing now new financing models, which means new administrative databases. This is a moment to think about how to design them in such a way that they can produce some useful quality information. And yeah, I think that's the thing. And the point all the time is to try to keep a link between what you're doing on a local level you do in terms of performance and the overall system goals. And that's a long pathway, but it has to do with alignment of the information. And we see now in OECD countries that that's a big issue, how to align your national performance scheme with your regional performance scheme, with the hospital and other performance measures. So we're now going to a period with a plethora of measures and measurement system and things, but how to align them in a logical way that they strengthen each other, that's a challenge in industrialized countries as well as in low-income countries that are still in the process of developing it.
Thank you, Bruce and Nick. And I think we're going to switch. Others are coming up to the front of the room.